Good afternoon, and welcome to the City of Hamilton's internal town hall meeting. Our goal today is to update you on our response to the COVID-19 emergency and Hamilton reopens the city's COVID-19 recovery plan and roadmap to our new reality. My name is Jasmine Graham, and I'm a Senior Communications Officer in the City Manager's Office and your host for today's internal town hall. This afternoon, we're joined by a panel of senior leaders from the city. I'd like to welcome our City Manager, Jeanette Smith, our Emergency Operations Center Director and General Manager of Healthy and Safe Communities, Paul Johnson, our Medical Officer of Health, Dr. Elizabeth Richardson, our General Manager of Planning and Economic Development, Jason Thorne, our General Manager of Public Works, Dan McKinnon, our General Manager of Finance and Corporate Services, Mike Zagaric, Laura Fontana, our Executive Director of Human Resources, and John Hertel, our Director of Strategic Partnerships and Communications. Thank you, everyone, for participating in the internal town hall panel this afternoon. For staff watching us on YouTube or listening on our phone-in line, we're here to answer your questions, and we'll get to as many as possible. To submit a question for our panel, you can email us at communications@hamilton.ca. To start things off, I'd like to welcome our City Manager, Jeanette Smith, with some opening remarks. Jeanette, over to you.
Thanks, Jasmine. Hi, everyone. Nice to sort of see you today. I hope by now you've all seen the emails that I sent out, as well as gotten some communication from your leadership team, and hopefully you've had a chance to look at the Hamilton Reopens plan. Today's employee virtual town hall is really devoted to you, to preparing you for the reopening of city facilities. We're going to answer as many questions and provide information on what our new reality will look like, because the reality is this pandemic isn't over and it's going to be here for a while. The one big message I want to put out there is the reopening process is going to be slow and safe, and it is going to look different for each of the work areas across the city. And the reason for that is we really want to ensure we're focusing on continuing to deliver municipal services, but in a way that's safe and responsible. We need to keep following that public health advice and look at measures like physical distancing, washing our hands frequently, not gathering in groups, and not coming into work if we're feeling sick. These measures are going to be critical in the weeks and months ahead. So in those weeks and months ahead, it'll be really important that you frequently check your emails and look for messages from myself or your leadership teams, so you have some sense on how your work may be changing in the coming weeks or even months. And the reality is, for some of us, it may not change a lot in the next little while, and for others, it'll be that slow and steady change. I really want to thank all of you again for all your hard work during this pandemic emergency. You reacted so quickly. You were flexible. You've worked differently. You've kept essential services going. And we have executed on the largest emergency and longest emergency response the city has ever done. So for that, I say thank you and well done. And I look forward to hearing your questions.
Thanks so much, Jeanette. So before we get to questions, we're going to hear a brief presentation by our Medical Officer of Health, Dr. Elizabeth Richardson. Dr. Richardson, if you're ready, over to you.
Thanks so much, Jazz, and it's a real pleasure to be here with everybody today. I'm going to do what we often do, and I'm going to flip up some slides because so much of what's gone on with COVID is easier to understand with pictures than it is for me to just explain. So I'm going to try that out. Just bear with me for a minute, and we'll give you the best that we've got here. So can you see that, Jazz, and everyone?
That looks great. Thanks. Go ahead.
Perfect. All right. So this is really a looks detailed, but just a bit of a representation of the journey that we've all been on together. And just reminding us that we didn't know anything about this virus. This particular coronavirus was discovered at the end of December of last year in China. We had our first case in Ontario on January 25th, our first one here in Hamilton on March the 11th. And really for the last 2.5 months, we've been managing this. It may not seem like a long, or it may seem like a very long time, I should say, but it's not actually been all that long that we've been at it. So I'm not going to go through this in detail, but you can see in blue, particularly the Hamilton milestones we've been at and all the other things that have gone on. It's just been a tremendous amount of work that has been done everywhere globally, across Canada, here in Ontario, and especially here in Hamilton. Let's see if we can get it to work now in terms of the next slide. There we go. So in responding to this coronavirus, because we don't know that much about it, we don't have any treatment for it, we don't have a vaccine against it. We know that it causes severe illness, particularly in people who are over the age of 65 and people who have chronic disease. And we know that from the experience of other parts of the world, like places like Italy, unfortunately, and Spain, it has completely overwhelmed their health systems. And
We're going to go
so
back to Jasmine.
we literally,
Oh.
Sorry, Bill? We literally threw the book at it in terms of responding to it. So we've done things like business closures, school closures, saying that no more than 5 people can get together, delaying healthcare. We have done a whole lot of work in managing cases and contacts, and done a lot of work in what is we affectionately call IPAC, but is infection prevention and control. In Hamilton, this is basically a graph of the total number of cases by date over the last 3 months. And you can see that there's been a steady increase in cases, but it's not been the what's called an exponential curve, that sort of rapid straight up to the sky curve that we've seen in some other countries. Instead, it's been some steady growth, and that growth has slowed down as we've gone forward. As we've been doing this, we've been changing the number of people we test too, which means we're detecting more and more of it as we go forward. And unfortunately, we have had some rather large outbreaks in some facilities, like the one that happened 2 weeks ago, and that's where you occasionally will see the large jumps. But by and large, here in Hamilton and across Ontario and Canada, we have done a very good job in complying with the public health measures that needed to be put in place in order to slow the spread of COVID-19. That doesn't mean there hasn't been a heck of a lot of work. So as we've gone through this in preparation for this, this arriving here in Hamilton, and then having to look at how to manage all of the various issues, and then looking as we turn to going forward and realizing that really we need to adapt to live in a world with COVID-19. This is not going away anytime soon. We still don't have a vaccine. We still don't have treatments. And even if we get those, we would say we're probably about 12, 18, 24 months away from being able to fully produce and implement any program that included that. So we really do have to figure out how to live in this world where COVID-19 is present, how to continue to minimize the transmission and risk associated with it, so that A, we keep everybody healthy and safe, but also so we don't end up in a situation where we do overwhelm the health system. There's something called the pandemic paradox. The better we are at managing the spread of this disease, the more people stay susceptible to it. And so if they're susceptible to it, if they can still get it, it means we have to continue to have measures in place. So I won't go into all the details of all the plans. Suffice to say, it's a lot of work and that we've done within public health, across the EOC, across the health sector to support us, and it will continue to be a lot of work. So you may have heard the phrase de-escalation. So when are we going to, go back to normal? When are we going to step back from all this? And as Jeanette started out saying, this is not a world where we're actually going to have to be able to go back to normal, go back to our usual practices. And I'll probably say that a good 15 times over the course of these few minutes, because it's such an important message. What we're talking about really is about reorienting what we do and trying to understand how much of those public health measures, how much of the physical distancing do we still need to do in order to maintain control of this, but while getting back up and running our economy, getting back to seeing our friends and families, the things that we know that are really important to do as well. We know that the measures that have been put in place have had significant economic consequences, that they've had significant impacts on people's mental health and well-being. And so we're trying to find a new balance as we go forward. So I'm not going to ask you to read all of this, but just to say there's been several areas that we've been looking at: testing, contact tracing, our health system, and lots of things we have been doing. And now we're sort of stepping back and saying, what could we do a little differently as we go forward? And the key components of what we see doing going forward continue to be about communications and engagement, making sure people understand what the key issues are, how do we work together, what do they need to do to stay safe. We need to look at safe reopening of businesses, our city business, and as well our community more broadly. And what do they need to do that? Understanding data and understanding what's happening is going to continue to be a main part of what we do going forward. And we're trying to develop a dashboard so we can track our progress. We've got significant work done on that. The testing and case management and contact tracing we do is absolutely key. And of course, we want to protect people who are most at risk, both from the virus itself, but also to the control measures, the things that we do have to continue to do, things like the impacts on mental health and those sorts of things. You'll see further in Paul's presentation, I'm sure, the concept of hierarchy of control. So when we're trying to reduce those risks, there's different things we can do. The best thing is to stay away from the virus altogether through physical distancing, but we know we can't always do that. So then we put other controls in place, like those plexiglass things we all see when we go to the pharmacy or to the grocery store, or we change things like schedules or that kind of thing. And then the last thing we should rely on, where we just absolutely can't reduce exposure any further, is personal protective equipment or masks. So one of the things that's important just to know in terms of how is COVID-19 spread, and we're still understanding this virus. We didn't know it at all 5 months ago. And so the amount of information we've gathered in 5 months is really quite extraordinary. But one of the things we do know is about 40% of infections happen when people are actually sick with the disease. We know that they start shedding that virus, they start being able to transmit it a couple of days before they get sick. So that's why case and contact management is so very, very important. Why identifying the people who are sick and the people that they are exposing who might then become the next person is really important. And so we have a lot of people dedicated to that within public health here in Hamilton and across Ontario. The other thing when we're thinking about businesses reopening is there's sort of two main things that we look at. One is the number of people who are going to be in a setting at any given time. So, whether there's just one or two people that's spread across a big area, and if you think about a museum, that's often the case over in that circle graph on the left. There's, generally not a lot of contact between people. On the other hand, if you're in a restaurant that's fairly crowded and you're sitting at tables together and you've got your server coming and going, you're going to have a lot of people in the same place at the same time. At the same time, it is about how long, how much time do you spend in those places. So again, when you're in and out of a place very quickly, then there's not really a lot of contact between you and somebody else. But if you tend to be there for a long period of time, that is going to be much bigger, much more of a risk. So we look at these different factors in terms of intensity. So an enclosed space makes it the contact more intense. The size of the room, a small room or a great big place like the big box stores. How long are you there for? Do you just nip in and out, or are you going to spend the next hour and a half in that spot? UV light really works to kill the virus. And so, of course, it takes a few minutes maybe for that to happen. So we still don't want to see everybody sitting next to each other in Trinity Bellwoods Park like we did last weekend in Toronto. But absolutely, people who are working outdoors, who are outdoors, that's where that virus is getting killed off very quickly just through natural sunlight. The ability to maintain that spacing of 6 feet separation is still really, really key. How much talking we're doing and the loudness of talking. So it turns out that when we talk, these little droplets come out when we speak, and that's what transmits the virus, these little droplets. And the louder you talk, if you yell, if you sing, you produce more droplets. And so that's important. So if you think about sitting quietly and chatting with somebody, that's very different than being in a nightclub, as happened in parts of Southeast Asia, where they started to see outbreaks when they were opening back up and that were associated with nightclubs with people singing and densely packed in together and talking over the music. How often you touch common surfaces is really important, and whether or not you're actually facing each other versus facing away. Things such as the number of contacts we've already been through. So the more people you see in a day too. So you think about the person who's serving somebody in a takeout restaurant, they're seeing a lot of people. So that does actually put them at slightly higher risk, even though it's short contact, than a person that maybe only sees one or two people through the day. We're also talking about community mask use. And so this has been an item that's kind of been out there. You've probably heard a bit about it over time, and you might be a bit confused about it because, it's been out there in Asia for a long period of time. Canada came out with it, Theresa Tam, probably a month or two ago. And then only just this past weekend did this start being talked about significantly at the provincial level. But again, back to that piece about people shedding droplets, what we're really trying to do with masks in the community is stop anybody who's in that pre-symptomatic phase, who doesn't yet know that they're going to get sick, or the very few people who never get sick, is stop those droplets right by where they're being generated, right at the mouth and nose. And so that mask is really there to stop. If I'm wearing one, it's to stop me from spreading it to somebody else. It does have some effect in protecting me from somebody else who's out there, but its main use is, as Jason Morgenstern, one of the students who's worked with us, has said, is altruistic. It is me helping to protect others in case I go on to get sick in the next couple of days. And it turns out if you put 2 layers of cloth, 2 layers of good sheets, or 2 layers of a thick t-shirt material, put those together and make sure that they're tightly fitting around your mouth and nose, turns out they're almost as good as a medical mask. So if people are wearing them, and it really does make a difference in stopping the spread. So overall, we've made 6 recommendations, which I've pretty much gone over, really encouraging people to come out for testing as soon as they get symptomatic, so we can help to them with isolation and help identify any contacts to stop the spread. Another piece about this is just supporting people who are in isolation and quarantine. So how do they need to be, how are they going to get food? How are they going to continue on during that time? Physical distancing, washing our hands, covering our cough with our sleeve, staying home if we're sick, those are going to continue to be the mainstay of our response to this disease. And that stuff is not changing. So again, the message of, oh, we can go back. No, we've been training for a couple of months, and like any good athlete after that training, we should have pretty good muscle memory about what we're supposed to do. And we should just be continuing that on in this new warm weather, in the new environment of going back to work. Those things are going to stay as a mainstay throughout all of this. Mask wearing in the community, if you're going to be in a situation particularly where you can't maintain that physical distancing, so we've talked about in transit or a small grocery store. And finally, just continue to move forward with that risk-based approach in opening our business as well as the businesses that are out there. So that's it from me. And I know we're going to come to the questions at the end. So Jazz, back to you. And I think we're coming up to Paul.
Great. Thanks so much, Dr. Richardson. So that was very interesting. Thanks for sharing that presentation with our staff today. So we are going to hear another presentation by our Emergency Operations Center Director and General Manager of Healthy and Safe Communities, Paul Johnson. So Paul, if you are ready, we'll go over to you.
Thanks, Jasmine. And we should be getting the presentation up. Thanks, everybody. And it's great to share a presentation that is very similar to one that we provided to Council yesterday. The good news is that you can see that presentation online and go back, because some of the slides here today I'm going to go through in fairly short order so we can get to some of the questions. But I want to begin by thanking all of those who have been working on this emergency across the city of Hamilton. For our public health colleagues, it started a little bit earlier than some of us, but for everybody who has had to kick in once we activated our Emergency Operations Center, a big word of thanks. Whatever role you have been playing in this pandemic, it is appreciated, and it is helping to make sure that the city keeps moving and that we can do the work to get to this stage, which is start to talk about the roadmap for getting back to delivering even more services than we are today. So I do want to take you back 78 days. That for the municipalities Emergency Operations Center, as I say, public health colleagues started just a little bit earlier, but from a municipal perspective, we began our Emergency Operations Center work and activated the Emergency Operations Center on March the 12th. And from that period of time, we did a number of things very quickly, including, of course, basically the full shuttering of all of the buildings that provided access to the public, and a scaling back of services to those that were most essential and most critical to the operation and the ongoing health and safety of our community. And I want to pause for a minute and say thank you to all of those who helped make sure that we could safely ramp down our services and our public locations. And that's not just the staff in our facilities group that did a tremendous amount of work, and big hats off to all of those folks who shut down the actual physical facilities, to everyone who was involved, all of our employees and our people leaders who had to share information that was coming in real time and help people to understand whether they were needed to deliver some of our services or redeployed to home, and sometimes redeployed to home without a lot of sense of what was happening next. And it took us those 24, 48-hour cycles to provide information. But it was all done in an exercise to keep you safe and an exercise to keep our community safe once we understood that this was one of the best ways to flatten that curve and stop some of the spread of COVID-19. Along the way, we've had to do a number of things, and I'm going to go through not an exhaustive list, but I did want to thank some and illustrate my thanks to many employees by talking about some of the groups in our city that have done some tremendous work through this. Obviously, our first responders as a group have had to modify their work because those calls don't stop. And they are ones that have had to take personal protective equipment very seriously because they are in direct contact and very much at risk of the transmission of this disease. But I want to stop here and talk about paramedics, not so much because of the work they do on a daily basis, which they've been well trained for, but some of the additional work that they're doing, helping with some of our testing, particularly our mass testing in certain facilities, helping us to do some things that we've had to jump into as a municipality to help out, like the decanting of patients and residents from some of our retirement homes, particularly the Cardinal and more recently the Rosslyn retirement home. So these are above and beyond the 911 calls and the other responses that happen every day in paramedic service. I want to congratulate our public health team and our facilities team who came up with a great idea to use an arena as a drive-through testing center. So rather than having a building and then tents attached to it, which we have to take up and down or risk having blow all over the place, our group came up and said, well, why don't we just drive people through an arena? And so this is normally kind of the way the Zamboni would come out. But in COVID-19 land, this is how people come through in their vehicles to receive the kind of testing that is going to be so critical as we move forward. So congratulations for getting up these types of activities in very short order, working across many divisions. For some of our services like transit, these were critically important services. I couldn't be more proud as a member of our Emergency Operations Center to be able to say to our community that we did not have an interruption of service, a closure of our transit service. Other cities did. They actually shut down transit services. And they did that because they couldn't find ways to work together as employees and management to keep those buses on the road. We did. And as a credit to everybody who works in transit and across a number of programs, we've been able to keep services going. And we've done that with a combination of keeping people safe and making major modifications in the way we deliver our service. We've had to shut down a lot of things, and a credit both to those in public works that were actually out putting up signs and making sure it was very clear what's open and what's closed, and also to the folks that do enforcement. So who are out there enforcing the bylaws, whether they're the provincial orders that we're delegated to enforce as part of bylaw, or also our own physical distancing bylaw, which was passed at the City of Hamilton. And I know that this has a tremendous impact on our community. At times, we've seen a little bit of civil disobedience as people have ripped down barriers and things like that. But our folks have been great at making sure that it's very clear what's available to the public to use and what's not. And we've been reopening things recently, which is a whole lot more fun than the closures we went through. To our waste folks, we had to adjust some service early on. And it's great to see now that we're back to some of that service. We suspended leaf and yard waste altogether. Then we brought it back on a kind of bi-weekly period where people had to leave it out the whole week and we try and collect it. And then we got to a state where we're back to much more normal operations. And along the way, we worked together to also determine how best to deal with safety issues, particularly the concern of having two people in a vehicle. And that has got its first start in waste and now has translated itself into a standard operating procedure and some of our occupational health and safety guidance as we move forward. So again, kudos to keeping the service going as we were learning about COVID and as we were learning about how to keep everybody safe. To some of the folks that work in what we call sometimes the back office pieces, but I can tell you, this is a picture of our customer contact center. If we didn't have the ability for residents to call 546 City and get information about services or how to get in touch with public health, we would have been in trouble. And the reality is that we were able to keep this up and going. We were able to keep our IT department functioning so that they could help now about 1,700 people working on either VPN or CityNet from home. That they could do that in a matter of a few weeks means that they were working incredibly hard and doing all the right things. It is the fact that we've all continued to be paid on a regular basis, and all of those activities that you take for granted. And I'm really pleased to see that all of those activities have continued to go without interruption. And then, of course, there were some really tough areas where we had to take some action. Our long-term care facilities, I'm so proud. Yes, we have had to declare outbreaks for some single cases of COVID positive results. They have not resulted in spread within our facilities. They have not resulted in major health issues in terms of the staff that have sometimes been COVID positive within our long-term care facilities. And we did that by taking decisive action. And thanks to the leadership there, we were one of the first group of homes that said, you need to decide where you're working. We need workers that only go to one site. Let's not have people traveling between locations. We went to full universal masking earlier than the directive that came out because we recognized it was an important way for us to keep everybody safe within our homes. They've been having redeployed staff do the excellent screening work on staff and any other critical visitors that have to come into our homes. But along the way, they've kept their humanity, and they've made sure that the residents who call our 2 long-term care facilities home are able to celebrate things like here for Joan and Tom, their 70th wedding anniversary in a state of COVID, many birthdays, and also lots of virtual visits. And then, of course, from a homelessness perspective, deciding to turn our arena into a homeless shelter to allow for physical distancing within that center, but also allow our other men's shelter system operators to lower their capacity so that we could have physical distancing within our existing shelter system. That on top of the fact that we have hotel rooms available, that on top of the fact that we set up an isolation shelter. I'm very proud to say yes, 2 individuals that experience homelessness were COVID-19 positive, but neither of those cases were in our shelter system. There has been no outbreak in our shelter system, no significant illness, and no deaths in our shelter system as a result of COVID. And that is something we can be incredibly proud of. They are one of the toughest environments given the nature of the population. So really well done. And then about 3 weeks ago, we realized that after all this good work, things were starting to reopen, and we needed to turn our attention as a city to how we were going to do this. And so then we decided that the best way to do that was to engage a team within the city and say, folks, how can you work with your departments and your divisions to start to map out what this is going to look like from a health and safety perspective, from a standpoint of looking at what the province was doing with their plan for reopening the province, with their guidance and with their orders. How could we put this together? It was a tough task. Dates don't exist. We don't know when things will occur. We're not entirely sure how we'll start up. But we threw it to this team that you see on your screen here, your colleagues at the City of Hamilton, and they absolutely nailed it. They took away what information they had. They looked at all the available evidence. They talked as a team, and they talked to others in the organization. And they are the driving force behind the document that we've shared with you. And this presentation is built, of course, upon those documents. So thanks so much to the team that's smiling here, because this picture was taken after they were done developing the document and had delivered it so we could present it to council. So as you heard Jeanette say, this is about gradual restarting of services, a gradual return to some of the things that are shuttered now, perhaps being more open to the public and open to you. And it is going to be driven by a whole bunch of information that I wish I knew when it was coming. I wish I knew how it was coming. The answer is I don't. The answer is Dr. Richardson does not. We are also looking at information, receiving information from the province or the federal government, and reacting as we go as well. Our guiding principles are on this slide, but the bottom line is we're looking to protect groups and populations. Certainly you and all of us as employees, we're looking to protect the public health of this community. We're looking to protect those who need a bit of our extra support in what we call the vulnerable sector. And we're trying to ensure that we do all of this with an understanding of what it is we have to provide and need to provide, but how do we do that very safely. So we're very much in these early stages, as we call it, whether you call it phases or stages or whatever else. The bottom line is we're in the early part of this. And you can see that because most of the things that you normally attend or work in, those buildings and facilities, are all closed. All of our recreation programs and our events in this community are canceled. And the reason for that, of course, is the order provincially that you cannot gather with more than 5 people unless you live under the same roof in a large family. And so this is a reality of where we are now, still very closed off. Some outdoor amenities are open, and as you can see, we have a few more that are opening as the province makes announcements. But very much it is about keeping our distance. Very much it is about keeping people away from congregating inside and in close quarters. And it's very much about all of those good things that we're doing around our hygiene. Some things in our community are probably inching towards this kind of gradual piece of restarting, and I would say that that's happening outdoors more and more. You do see golf courses opening, people with the opportunity to play tennis, what we call those individual sports that don't require team activities and close contact among opponents or close contact around participants. The opening up of more facilities within our park structures. I noticed that the skate park folks are back out in our skate parks and doing a nice job of also just delineating how you can go skateboarding and do it safely. But most of our recreation programs, events will still be canceled in this next phase. We'll be asking you to work from home if at all possible and limiting the number of people that are coming back to our environments. And there will still be significant restrictions on gatherings in the public. And as we start to move to what we call our new reality, I know there's other phrases out there for it, but we really like the term new reality because it grounds us in what is actually real, that we're going to be changing the way we think and the way we work for many, many months to come. And as you've heard Elizabeth talk about, in terms of the full immunity strategy, as it's called, we are talking into the years terminology here. The only thing that's really different on this slide, it's not a mistake, is we sort of remove the X through gatherings. That doesn't mean that we'll be back to 10,000, 20,000 people gathering in a park, but it's expected in this phase that there'll be a much higher threshold in terms of gatherings as long as it's done with the sort of physical separation and proper hygiene that's required. What that number is, I have no idea. You can see in other provinces where they're a little further ahead of us, or other jurisdictions, that those numbers sometimes are 50, 75, may get into a couple of hundred, but we are also a long way from having major events where lots of people gather in close contact. But this is also the period of time where we may be having more people come back to physical environments and buildings, and that really takes us into some of the next piece. So what we did and that team did is look at all of the service areas across the city, and we define things as in the next little while as happening in 4 buckets. One is some things actually have no change. They're few and far between, but there's actually a couple of things that are doing exactly the same things that they did prior to COVID-19. As I say, that is such a small category that we're not going to spend any time on that. Many are going to be proceeding with a new model, and this is the kind of stuff where you see a change in the way you deliver the services and we deliver the services, but the residents probably won't see much of a difference. And then we have some services that are modified a little bit more. People will see a bit of a difference. A good example of a modified service, of course, is transit, where things are different, but we're still running our transit system. And then we do have things that are canceled. We directly deliver some childcare services. They are closed. Our recreation facilities are closed. So there are some services that, even through some of the phases we're moving forward on, may be canceled, not operating even under a modified way. So here's a couple of examples. Council is in a modified way right now. It's all virtual. They may proceed to a new model that would have much fewer people packing our city council halls. You know, some of you have seen on TV, some of you have participated in meetings where literally council chambers is full to capacity, and we have chairs set out in the lobby area, the second floor. Those are the kinds of things that will not happen in these next phases, even when we start to move through some of these phases, because that will simply be too many people in too close proximity. But we do see, as we move through these phases, that there will be an opportunity at some point, as you've seen at the provincial level and the federal level, for more of the meetings to actually happen in person. From a waste perspective, again, we talked a little bit about this. Some services were suspended in the early part of this initial response to COVID-19. And as we move through these phases, more of those services will come online, but we don't see waste. Some of the things that waste do, in terms of some of the delivery that they make in the community, happening in the same way. Building inspections, right away we said, look, they need to be exterior only, and they need to be with very few people. Well, we'll start to move to having inspections done inside facilities and in more of the normal way, but obviously looking at ways that people can remain safe as they do so. And an example from public health is a lot of the services that are critically important to the chronic disease and injury prevention that has nothing to do with COVID had to be curtailed early on. Only emergency dental services sort of prioritize clients getting some counseling. And of course, we want to move to having more of that done, but it's not going to be done in the same way. And when things are done in person, they will look very different both to our staff and those who utilize the services as we move forward. Elizabeth's touched on this. This is a really critical point for people to take away. Our approach to our safety collectively and the safety of our public is based on this model, which says that we are looking at ways to eliminate exposure. That's the best. But we know in our environments and we know in our work that sometimes we have to move through the categories of managing exposure. How we eliminate exposure and is really about that physical distancing, just not allowing us to come in contact with those droplets is the best possible way. And we'll do everything we can to be at that end of things. But then we start to get into, well, how can we do that if we can't have that separation? And it may be about physical barriers. And so as late as today at the EOC, we were talking about how we're ordering those plexiglass pieces that will provide that physical protection that would block the droplets from traveling the distance that we may not be able to keep you apart from. The other piece is, of course, our processes and how we go about our cleaning, how we go about encouraging people to behave in different ways, the screening that will be in place for you as employees and for some of our visitors as they come and access services. The final piece is we do have many services delivered at the City of Hamilton, and you saw a couple of examples of that, for which we have to manage the exposure because it is part of the job. As a paramedic, you simply cannot get to the physical distancing part of this upside down triangle and live in that sphere. It's not possible in our long-term care facilities and in some other parts of our work. So we do have to talk about PPE, and when you'll see as you go through those services that PPE is a consideration. And so here's a couple of examples of how life changes. We did not have a plexiglass barrier at our golf course. When we opened our golf courses last week, we now have those plexiglass barriers when people come in and pay. The illustration on the right is not the full standard operating procedure for cleaning, but you know what? Our cleaning for vehicles is very different, and it will be very different for those who access city vehicles to keep you safe and to keep others who may be using those vehicles safe. And so one of the pieces of work that we spent a lot of time on and the team spent a lot of time on building was how do we look at and how do we provide you with information about what we look at to in terms of our occupational health and safety regime for different work environments. And we came up with about 15 different types of work environments that we exist in. You know, some work in office spaces, some are outside. We actually have some people that work in laboratories. We have obviously our waste collection and people that operate transit vehicles. So there's all sorts of different areas, and we tried to come up with a good articulation of what the differences would be there. And when you read the report, you'll see that across 6 domains, we have the expectations of what the City of Hamilton will be providing to all of us as employees, and the expectations we may have in certain cases of those who are coming to access those services. And you'll see on the right side of all of these slides that many times across these 6 domains, we will have links in the document and we will have links in the website that you can go to so you can see the new processes and procedures that we have in place around things like cleaning, around how we're dealing with physical distancing and things like elevators. So we've had to think about that. How do we make sure that we have some protocols in place and some advice for people who work in buildings where there's elevators in place for how you get around. And also along that, so if you look at this in an office space environment, we're going to have to stagger breaks and lunch hours and things like that because we can't have people piling into these common rooms and interacting in the same way we used to. It's just not going to allow us to keep that physical distancing and also not allow us to clean those high touch surfaces frequently enough. We are going to encourage all of you to think very clearly about what are simple rules to follow, but are critically important rules to follow. And that's about your hand hygiene. That's about making sure that if you notice there isn't soap and water available in facilities, we fix that instantly. And where we don't have access to soap and water, which is really a great way of doing it. You don't need the alcohol-based hand sanitizer. Soap and water will do the trick. Dr. Richardson was pretty clear about that early on. But where we can't have access to soap and water, let's make sure we've got that sanitizer available and all the other good things we do to stop this spread. You will be asked, as all employees, and in some ways our visitors will be asked as well, to do some screening. It is a way that we can make sure that we understand if there's a potential that people may have been exposed and may need to have some further testing done if that's necessary, or some further discussions either with their own healthcare providers or with us. So we're going to look at ways to make this relatively fast, and it's because it's going to happen on a daily basis, and even exploring some apps that may help us do this as well. And finally, you can see here that PPE is not required in an office space in terms of as an absolute requirement, but we do have protocols and policies and approaches in place around PPE. And I know everybody is asking about masks, and quite often, the comment back is, I really want all this for me to return to work, or is it safe for me to return to work without it? And the answers are, if you go back to that triangle and we look at all the things we're putting in place, we believe that PPE is a part of it, but is not the only thing that we're looking at around safety. And then finally, we have to continue to communicate. The one thing that all of us have learned through this is that things change. There was a time where there wasn't strong encouragement around masks in public, and now, of course, it's a strong recommendation if you can't keep that physical distancing that you are wearing a non-medical mask. And so things evolve, and it's not because people misled us, it's because we're learning about it. And I love how Dr. Richardson started, but we found out about this in the later part of 2019. And so to expect in May that we know everything about it and can give clear advice that never changes is really just fool's gold to think that. So we go through these in terms of outdoor workers. As you can see, it looks a little bit different, because when you work outdoors, there are different considerations. And you can see that some of those pieces are similar, staggering breaks and lunches and things like that. But physical distancing when you're outdoors is a little easier than in some of our indoor facilities. And so there's an advantage there, but still the same requirements for it. Much of the stop the spread will be the same across all of our work environments, and the health screening as well. And then when we get to all of these different places where people work, there's going to be different guidelines in terms of the use of PPE. But the one thing that also doesn't change is communication. We did talk to council about some areas that the EOC is not in a position to simply decide how things will happen. Because of their length of duration, because of the size and scope of the resources required, we're going to be working together with council to think about what providing services to our homeless populations, those living in extreme poverty, looks like, and some of our other vulnerable sector members who may need help through this next long period of time. We're going to have to talk to council about the impacts on recreation. There isn't a pathway in the next few weeks to see the same volume of people coming back and using our recreational amenities. And we'll have to talk both about doing things differently, but also about what that means from a budget perspective with reduced revenues. In long-term care, the use of PPE is enormous and will continue. And we'll also have some staffing requirements that will be beyond what we were doing even just a few months ago. In childcare, this is an area that, quite frankly, concerns me quite a bit, not just from the community perspective, but from our staff's perspective. Many of you may have young children and require childcare. It's part of how we come to work each day. The reality is all that we're seeing right now is that there will be far fewer childcare spaces available in our community because of the impacts of how we keep children and the caregivers and their families safe. If that's the case, how will we balance that off with the need for people to get back to work? And how will we ensure that the programs that are open remain viable? In public health, Elizabeth can tell you the numbers, but it's 200 and some odd people are really working solely on COVID-19 out of just over 400 employees in total in our public health unit. Obviously, public health has other work to do. Obviously, there are significant impacts going forward as the contact tracing and all of the work that they're doing to help us through this pandemic continue. And then, of course, transit. Not only is transit down in revenue, transit may be changed for not just a few weeks and a few months, but it may be changed for a number of years as people's faith and trust and confidence in boarding public transit needs to be rebuilt, not because of anything we've done, but because of what this virus has brought to us. And the final piece is, what do we do to help encourage different kinds of mobility as people use transit less, as people use taxis and ride shares less in our community? So we just wanted to let you know that there are a lot of things that are happening that require us to work in concert with council. And just want to let you know that the Emergency Operations Center in no way is standing down. We'll continue to be there to deal with those moments of needing to jump on something quickly, make quick decisions, perhaps respond to some local public health advice about things that are happening because of the virus. But in some of those bigger baskets of work, it is going to be up to council to discern and, quite frankly, deliberate and go through some very tough conversations about how as a community we'll live with COVID moving forward. Thank you very much.
Great, thanks, Paul. So we are going to get into some questions from staff now. So as a reminder, if you have a question that you'd like to submit, you can email us at communications@hamilton.ca, and we'll do our best to get to as many questions as we can. So our first question will be to Jeanette. Jeanette, so how were the decisions about which teams returned to the office in each phase of the reopening plan made?
Okay, I'm
There we
unmuted
go.
now.
Go
Thanks,
ahead.
Jasmine. I think I was touching my button and I wasn't supposed to, so I apologize. You know what? The team used a number of criteria. First and foremost, they considered the health and safety of the staff and then the clients that we're seeing in those facilities. That was first and foremost. And you saw some of the information from Paul on the different things with the pyramid, et cetera, and what they considered. Other things they looked at, obviously, is provincial orders. So there's some things we just can't do because there's provincial orders around it. And we know that's why there's no timing, because we don't know when those orders will change. And we're also cognizant that we're going to get advice from Dr. Richardson of what the impacts are on the virus. Third thing really is we're trying to look at our service levels in terms of we've got approved service levels from council. What are the ways we can do things to try to maintain those service levels and understand the impacts on our residents and businesses? Other criteria they looked at was around the feasibility and ease of implementing those public health measures. The reality is, to achieve physical distancing, we can't bring everyone back to the office. It's just not feasible. So we had to systematically go through all those different services and where they're delivered and which ones are we having some challenges delivering by working from home, and looking at the experience where some of them, they're doing a great job working from home. And so we're going to leave people there working from home. It's the safest place to be, and we'll continue to deliver services. So once you start looking at all those different criteria, it starts becoming evident which staff need to come back. And I know that's going to be hard for some that really do want to come back, but we're going to need you to continue to work from home.
Thanks, Jeanette. So the next question will be for Dan McKinnon. Dan, will the city be making modifications to city workspaces like higher baffles or plexiglass barriers to ensure separation of staff in the office or in other settings?
Chaz, I guess the answer to that is both. One of the conversations that we had as SLT was this issue of whether or not the corporate standard for workstations was going to be appropriate in a post-COVID-19 era. And so the decision was made by SLT to remain with the existing standard, and specifically around the size of the workstation being an 8x6 and the baffles being at 51 inches high. Having said that, there's going to be areas of office spaces and different workplaces where we may have to create physical barriers. And the example there, as you just alluded to, might be a public counter where you have a lot of members of the public coming in and doing business with us at a counter. So you may see the acrylic shields being installed in those locations. And I think one of the things that we just have to keep remembering in that kind of hierarchies of controls around infection is the notion of space and the physical distancing. So regardless of whatever corporate standards we come up with when it comes to the workplace, there's always going to be spaces and opportunities where we're going to have to think through it. And so as long as everybody keeps those kind of hierarchy controls and that primary one, if you can keep physical space between you and other people, then that's the best approach to take. It's the safest one. So notwithstanding the fact that we're going to change some things from a corporate standard perspective, some things are going to stay the same. When we get back into the workplaces, there's likely going to be some things that we're going to have to continue to work through, but we'll continue to use that hierarchy of controls as our guide for that.
Thanks so much, Dan. Our next question is for Paul Johnson. Paul, once the city and the Emergency Operations Center make a decision to restart a city service or bring a group of staff back into the workplace, how much notice will staff get to prepare before they have to come back to work?
In these stages, there'll be lots of time. I can't say it's a week or 2 weeks or 3 weeks, but there'll be lots of time because we're not asking essential services or critical service workers to come back. That's already been done. There should be a good period of time. And what I would say in terms of a definitive time is that it will be as long as we need to ensure that when employees are back in a facility or back doing that work, that is to be done safely. And so while we have the occupational health and safety work done, and we feel very confident about what it is, we also know that as we start to bring people back, we want to have those conversations to ensure that we thought of everything. So it is a slow process now because we're not talking about firefighters or paramedics or folks that work at water. They're already there doing that work. We're talking about folks here where we'd be restarting a service, and we will not do that in a rushed fashion simply to meet a public pressure or an announcement from the province of Ontario. And just to let people know that we take that very seriously, is that we did not open our golf courses on the Saturday that we could have, because the information came out, about 48 hours before that. And when we talked about it, we said, we're just not ready. We haven't talked to our staff. We haven't trained our staff on the new protocols. And so we opened our golf courses the following Wednesday. It is that kind of approach we'll take every time we restart a service, that it's when we're ready, and there will be lots of lead time.
Great, thanks, Paul. Next question will be for Jason Thorne. Jason, in City Hall, we have several areas that provide counter service, and how will we ensure the safety of our counter staff as those services become available?
Thanks, Jasmine. So yes, we do have a number of counters at City Hall. Not just City Hall, we have counters at parking and licensing and animal services. And so much of what I'm going to say applies to those counters as well. And I think for starters, maybe I'll just sort of emphasize a point that Paul just made. We're not going to rush it. We're not going to be starting to open counters until we know we're ready, and until we know we can do so safely, both for staff and for the public. I also don't anticipate that it's necessarily going to happen all at once. We'll probably see a staggered reopening of counters as we feel we're ready to do so. This is not something where all of a sudden on the same day every counter is going to open at exactly the same time. I think this is going to be a phased in process. I would say one of the things I'm actually quite proud of in terms of the department is, despite counters being closed, almost all of the services we've always offered, we're still able to offer because we've become more creative in how we do it. And we've been doing a lot more digitally and electronically, from building applications to planning applications to how we do screenings when people, if they want to dispute a parking ticket. All of that I expect is going to continue. We're still going to continue to deliver as many services as we can digitally and electronically. So there's less of a need to come into any of our counters. And I say that's sort of step one. There will be signage on all of our facilities so that any members of the public coming in will do that passive screening before they enter the buildings and before they come up to any of our counters. And then at the counters themselves, those are going to look different. We are going to see the plexiglass barriers in place at the counters between staff and the public. So the experience at the counters is going to change. And I guess the key thing I'd emphasize is that this is not going to be a rushed or fast process. We're going to phase it in and stagger it in as we're able to do so.
Great, thanks, Jason. Just as a reminder to everyone, if you do have a question that you'd like to submit, you can still email us at communications@hamilton.ca. We are taking questions live, so email us if you have something you'd like to put forward. The next question is for Dr. Richardson. Dr. Richardson, the question is related to what will happen if someone who works for the city tests positive for COVID-19 or is suspected to be infected. How will our staff be informed about possible exposure or know if they need to get tested?
Thanks, Jazz. And of course, it's a question that's on all of our minds, and it's been on our minds all the way through managing this outbreak. And So for any case of COVID-19, if somebody is diagnosed with it, it's what we call a reportable disease, which means that the lab, the doctor that's involved, they let public health know that the person has been infected. And then we follow up with that individual to make sure that they're able to isolate, that they've got the supports they need to do that. We look at their home environment to say, you know, what can you do? How can you help to keep your family safe if you live with family or if you live with roommates? And then we do also look at where you might have gotten it from and the potential for spread that might have happened in that time period before you got sick and knew to stay home. So we go through and investigate all of that information before as we go forward. And we do follow up with contacts and that sort of thing. The other thing we do is we work with that person over the next usually 14 days to make sure they continue to be okay and they have the things that they need. So we do, for example, supply some masks if there has other people in the house, they need to leave the room that they're in during that time period. So we work with them to make sure they have those supports in place.
Thanks, Dr. Richardson. Next question will be for Laura. Can you talk a little bit about some of the measures the city has put in place to ensure those employees out in the community are safe and protected as they continue to deliver frontline services? May I mute you there, Laura? There we go. Go ahead, Laura.
Okay, all right. Thanks, Jasmine. So I think Paul actually spoke quite eloquently earlier on the hierarchy of controls. So it's from eliminating the exposure to managing the exposure. And there some of the protocols that will be put in place as people start to re-enter the workforce or continue to provide those essential services. Again, working from home is one of the primary ways to eliminate the exposure, maintaining the physical distancing if you are in the workplace, restricting the number of employees on the work site, and then managing the flow of employees once you're in the actual workplace. And then if you are in the workplace, adjusting the physical workplace parameters and all of the equipments and structures in place, rearranging desks, for example, spacing out the workstations, installing barriers and plexiglass where appropriate. And Jason spoke to that a bit earlier in terms of the customer service desks and so forth, and then ensuring the proper ventilation and that meets industry guidelines and so forth. And then adjusting the processes. So implementing health screening for all employees, and employees will have to do that on a daily basis. And there's apps that will be in place, and that folks can measure their temperature, as an example, respond to a very specific question as to whether or not they may have the virus and what their exposures may be. Encouraging, of course, employees to practice good hand washing and other hygiene techniques before they come into work, while they're in work, and ensure that it's done on a very regular basis. And then increasing the cleanliness and the disinfecting of the offices while you're there, before and after. So all of those protocols will be in place. And then again, managing the exposure, when we talked about the providing the PPE, so where appropriate, and that's primarily in those folks providing more essential services, providing the masks, face coverings when required, and ensuring that their exposures are limited and that they're protected as they're doing their work.
Great, thanks, Laura. Next questions will be from Mike. Mike, will we be able to book common space such as meeting rooms, and what will the rules for using these shared spaces be? We'll just get you off
Muted?
mute there.
Yeah,
There you go. Thanks, Mike. Go ahead.
thanks. And I have to say that's a big violin over your shoulder. And
It is a big
hopefully-
violin.
hopefully we'll see you play that at the end of the day. So again, similar to Dr. Richardson's earlier comments and Paul's comments, is we'll have to abide by the guidelines as it relates to common space. Some of the challenges one can expect is entering common space and exiting common space. We experienced some of this early on when we had our initial council meeting before we transitioned into our virtual council meetings, is needing to have that physical or social separation, as well as accommodating all the participants. So again, and as it relates to common space in general, we'll have to abide by the guidelines around social distancing, physical distancing, and just navigate as it relates to, again, how to enter, how to exit, and just respecting not only the health and safety of our colleagues and peers, but ensuring that we protect ourselves as well.
Great, thank you, Mike. Next question will be for Jason. Jason, will there be any taped walkways or no-go areas around photocopiers or other shared spaces? Can you speak to that?
Sure, and I think the short answer is yes. And the details are contained in the protocols and procedures that I know Jeanette has previously sent out the links for. So I think any sort of common areas, whether it's hallways, whether it's photocopiers, whether it's lunchrooms, you're going to see some differences. Part of it will be around modified cleaning procedures. So our janitorial staff will be doing more frequent cleaning of some of those common areas, and then within those common areas as well. So for example, in kitchens, and I think some of this was alluded to earlier, expect to see maximum capacities, limitations on the number of people that can be in kitchenettes at the same time. Probably some of the seating or even all of the seating removed, so you don't have gathering in the seating in the kitchen areas. Cleaning supplies, so you can clean before and after use of the area. I think Paul mentioned earlier about staggered breaks, staggered lunch hours. So some of those things I think people can expect. And then yes, around, if for example, photocopiers, if it's areas where people may commonly queue, you'll see what you see a lot now in grocery stores and things, the markings on the floor to show the physical distancing if you're standing in line. And again, high traffic areas, if it's hallways, things like that, we may see in some office settings. Again, something that people are probably getting used to as they see them in stores and things right now is the arrows on the floor to try to direct the flow of traffic in order to maximize the physical distancing. So those, I think, are just some of the changes people can expect to see in the common areas as they come back to work. And again, there's more details spelled out in some of the protocols and procedures that Jeanette has sent the link out to.
Great, thanks so much, Jason. Next question will be for Laura. Laura, if someone is assigned to work from home, can they work from an alternate location like maybe their cottage or their trailer?
So the short answer is yes. If they've got the proper infrastructure in place, if from an IT perspective, they're able to connect into work, it really doesn't matter where you're working from. It simply is necessary that you're able to connect and do the necessary work. So work location, provided that you have the proper equipment, the proper infrastructure in place, and you're able to do the work as required. It really doesn't matter where your work location is.
Okay, great. Thanks, Laura. Next question we'll ask to Mike. Mike, can you speak a little bit about what kind of financial impacts the COVID-19 emergency will have on the City of Hamilton?
So just make sure I'm
You're
muted
good.
here.
Yep, go
Okay,
ahead.
great. Thanks, Jasmine. So let me first start off, and I'll try not to be long, bit of a primer in terms of how municipalities are different from the province federal governments. So very much appreciative of the measures that the provincial and also principally the federal government's done as it relates to, for instance, income protection programs, rent protection programs, other measures. Those levels of government, they can run deficits. They can issue bonds to pay for that. They can issue debt for operating costs. Those are all measures that municipalities are not allowed to do. So we're not allowed to run a deficit. If we have a deficit at year end, we have to make up that deficit in the following year. So that's going to create a significant challenge to municipalities. Some of us recall the 2008 recession, and we thought those were difficult times. These are very much difficult times, even in comparison to 2008. We took a report to council early on to project out to the end of May, and we'll take a report to council in the next few weeks, giving a sense as to what a 3-month lockdown and what an extended 6-month lockdown looks like for the city of Hamilton. So you saw images in Dr. Richardson's, Paul's presentations of PPE, staff wearing PPE. You saw images of our residents and clients, for instance, transit using backdoor boarding and foregoing paying for transit. You heard references to protective measures in the workplace. You may have heard where the city was waiving parking fees, as well as we were rebating our clients who had subscribed to recreation but weren't able to access the recreation. All of that represents either expenses to the city or foregone revenues. And currently, we're projecting about 43 million to $122 million deficit for 2020. And that's huge. As I mentioned, we can't run a deficit. So what is it, $43 million impact if we have to raise those funds next year? It's about a 5% residential property tax increase over and above what we had assumed for 2021. So again, we're going to need some help from provincial, federal partners as it relates to mitigating or offsetting some of these pressures. And I'll just leave off. We're going to have to work with staff beyond 2020. This is going to carry on into 2021. We know that there'll be an impact in terms of how people use transit, possibly how people use our recreation programs. Paul made reference to golf, very different level of participation that's available for golf. So we know we're going to continue to lose some of our revenues and our recreation revenues, transit revenues, and those represent about 13% of all of our revenues. So again, beyond 2020, we'll have to work with staff, with council towards some solutions going into 2021. But most importantly, we're going to need some help from our federal and provincial partners.
Great, thanks, Mike. Next question will be for John Hertel. John, there's a lot of information about COVID-19, about the COVID-19 emergency being shared inside the organization, but also through public events and with the media. Can you talk about some of the best ways for our staff to keep updated and get reliable and timely information?
Thank you very much, Jazz, and hi, everyone. Throughout the meeting today, you've heard the word communication time and time again. And I think, as we've said a lot at the EOC meetings, when we were shutting the system down, if you will, it's a lot easier in some respects in the sense that it's black and white. So if something's closed, it's closed. As you're now reopening, the need to communicate is probably even higher. The nuances are greater. And so the job has not, I'll say, fallen off. It's become perhaps a little trickier. We're really, really lucky that we internally have a team that covers, I'll say, all the bases. So all of the messaging, social media marketing, our web team does an incredible job updating daily. And of course, all the graphics that you're seeing are all produced in-house as well. So to me, it's most important that all employees have an opportunity to be kept up to date in real time. So what are those opportunities? Well, one of the ones that has been extremely popular and very real time are the twice a week media briefings that we do. They're as late breaking as they can be. They have, generally speaking, followed orders that are coming from the province, and in a very short period of time, they get sort of rushed through the EOC, decisions made, and then a couple hours later, Paul and Dr. Richardson and the mayor and sometimes guests are standing in front of cameras and sharing the news. So that's absolutely important. It's also really important, if you don't currently, to number one, follow us on social media, because that's extremely real time. Howie, for those who do not have regular, easy access to the network, please, if you're not signed up yet, do so. We have been running every week. We've been running town halls as well, which is more of a general public intake, much like this. We're shifting that a little bit to not be every week. They'll be on a bit more of a special occasion, but at the same time, we're going to make them more interactive. So there's quite a list of things, and I want to emphasize that every day the website is updated, and all of the stats that you hear Dr. Richardson and team talk about are updated daily, et cetera, as well as all of the provincial orders. So I would say one way, for example, to on a regular basis for employees to always be up to date in terms of any information and support. If there's a single spot to go to, it's probably the website because of the FAQs that we put up, et cetera. Also important, though, that you noticed, as Jeanette mentioned, she's putting out very regular communications to all staff and putting critical information in it. And the last thing I'll say is that this is where folks can really chase their directors down. So every Thursday afternoon in this normal time slot, we have the corporate leadership team, or the CLT meetings, and a lot of information is shared with the directors that we're asking them to cascade on to the rest of the team. So a real series of things that we're able to do. And you know, if I can brag a little bit, we've heard a lot of great feedback from people about the frequency and volume of communication that's coming out of the team, particularly from folks who either work in or live in other municipalities. So we're holding our heads pretty high here, and we welcome your suggestions and input anytime as well. Thanks, Jess.
Great, thanks, John. Just as a reminder, if anybody would like to submit another question, we are still accepting questions. You can just email communications@hamilton.ca and we'll do our best to get to your question. Next one goes to Dan. Dan, how will the city manage the use of elevators and small confined spaces as we begin to reopen and bring more staff back to the workplace?
Thanks, Jazz. I think I want to continue to repeat the things we said earlier about the hierarchy of controls, or the hierarchy of exposures, because that is really the principle that kind of guides a lot of the procedures and policies that have emerged as a result of this. So the policy is specifically drafted for the use of elevators essentially dictates that no more than 2 people on an elevator. Again, if you're in an environment where it's an extraordinarily small elevator, we would encourage it maybe only one person go in it at a time. And conversely, if you're in a situation where it's a freight elevator that's 8 feet by 10 feet, you might be able to get more than 2 people on there. But generally speaking, we're asking no more than 2 on an elevator. And so I suspect that this is probably going to, you know, inspire people to use the stairs more, which is probably not a bad thing. And it's probably going to create some awkward moments too, because if there's 3 or 4 people waiting for an elevator, there's going to be, you know, a bit of a standoff there while people are looking at each other about who's going to get on and whether or not they're going to get on. But the policy as it's drafted right now says no more than 2 on an elevator. And but again, encouraging people to think about those hierarchies of controls, because when you're confused about a situation, if you always have them kind of in the back of your mind, that'll always help to guide you as far as decisions that you need to make, whether it's an elevator or whether it's you know, your workstations or any other environment that you might find yourself in.
Great, thanks so much, Dan. Jeanette, the next question is for you. I'll just read it. Says, I read in the Hamilton Reopens plan that there will be enhanced cleaning. I work in an office environment where I am concerned about common areas like washrooms, kitchenettes, photocopiers, and meeting rooms. Will this cleaning occur throughout the day or just after hours? And if it's during the day, who is responsible for doing it? Oh, we'll just have you unmute yourself there, Jeanette.
There we go.
Excellent, thank you.
Thanks, Jasmine. Yes, we know we're going to have to do more cleaning than usual. A lot of it will depend on the number of staff that are coming back into the buildings and the different common areas, things like the photocopiers. So we've got using the health and safety guidelines. We've got standard operating procedures about increased cleaning. That not only includes our staff, but also for some of our third-party vendors that are coming in and cleaning our facilities. So that will be all thought out and planned out, and everyone will be informed of any of the accountabilities before people come back in. I think you hear some really common themes over and over as all of us are answering about that, slow, measured, the importance of health and safety, using that hierarchy of controls. We truly are putting every decision through those lenses to make sure staff are going to be safe.
Thanks, Jeanette. Next question will be to Paul. Paul, as employees return to their physical work locations, will the city have mandatory COVID-19 testing for employees as some other municipalities are doing now?
So important to separate out screening and testing, because it's going to be yes around screening, but the city at this stage has not made a determination that in order to return to work, you must have had a test. And Dr. Richardson can go into the whole testing thing, and we could have a town hall on testing, I think, Dr. Richardson, in terms of that. But the reality is, of course, testing, and you may have seen some people suggesting that all employees need to have testing. Well, it gives you that snapshot in time. And I don't think it's practical for us to say on a day-by-day basis or whatever the frequency is that we would do the testing. So no decision has been made that we would mandate testing. There may be certain environments where testing does happen under other regimes, and the example of that would be long-term care, where there was work done to test all staff and all residents in long-term care. So in certain cases, there may be some provincial directions and things that happen, but from a general perspective, you're not going to have to go and have a test for COVID-19 before you come back to work. Screening is another element, and I get it's related to testing, but it is separate. Absolutely, there will be active screening of staff. What does that mean? It means that you will need to answer some questions, and there's you can see the tool and understand the screening, and many people are using it on a day-by-day basis today. You need to answer those questions, and should some of those questions flag that there needs to be a further follow-up, and some of that further follow-up may be you connecting with your healthcare provider. It could be your family physician. If you do have underlying health issues, it's not an automatic that it's yes or no. Sometimes it may be that you need to talk to your doctor and see what their suggestions are in terms of how you can be safe, and then connect with human resources around that. But everybody will have to do it each day, and there are some big flags. So if you have some symptoms, and the symptoms list is much larger, and I know for some people, they may have seen the list early on, and because you've been at home, you haven't really worried about the list of screening questions. But over time, there's been an additional number of symptoms that have been added to the list. And when you go through that screening, if the answers are all clear, we're good to go, and you'll be on site. If the answers are not so good, then we'll be encouraging you to make the right connections to ensure that you're safe. We are exploring an app that will make this easier. It's not going to be connected into our system, so it's not going to draw on your personal information out of our server and have to have you with a device that's connected into our server. It would actually be a tool that's online based that you could use, and what it would do is allow you to do those questions and answer those questions, perhaps while you're having the morning coffee or tea and a bit of breakfast. And then if you're good to go, it will already have cleared you, and you can arrive at the workplace and not have to spend the time going through those questions when you arrive at the workplace. But we know that can work in some environments, not in others. So everybody will be required to do it in some way. How it's done in our facilities may differ. So yes, you will be asked if you're feeling well, and a whole bunch of other questions about that on a regular basis. But the testing side is really still, if you think you've been exposed and some other things, follow the guidance. It's on our website. There's good information there from public health. It is changing a little bit, and why we just want to wait is that we're still receiving some information from the province. And I know that Dr. Richardson and her team will look at that and then update the website accordingly, because there's lots of conversation now about, following the Premier's comments about if you need a test, want a test, feel like a test today, go get a test. It's creating a bit of capacity challenge for us. So we're just working through that. But expect as employees of the City of Hamilton to be required to go through the screening on a day-by-day basis when you come to work.
Great, thanks so much, Paul. Dan, we'll go back to you for the next question. What is the city going to do relating to air quality in office space when we return? And are there any concerns about HVAC filtration as it relates to COVID-19?
Thanks, Jazz. I don't think there's a widely accepted kind of scientific knowledge about the impacts of COVID-19 as it relates to HVAC systems within buildings. Having said that, I know they're studying that. Rome and his group are keeping a close eye on that. We will be required to do certain things because a lot of the facilities have actually been empty. So Rome and his team will be in buildings where we are planning to return to get the HVAC systems up and running. We're going to have to pay more attention to them, obviously. Generally speaking, where we have large groups of people working together in a single office, it's a fairly sophisticated HVAC system that would be feeding air into those environments. So making sure that they're working properly and are working in advance of people returning to the workplace. That'll definitely be happening ahead of time. We've got an operating procedure and a request procedure that is specifically to HVAC as a result of the COVID-19 experience. But I don't think that there's, at this point, certainly we're not aware of any widely accepted theories that it could necessarily make the situation worse because of COVID, but we'll be keeping a close eye on that.
Great, thanks, Dan. Next question, Laura, we're going to go back to you. For those staff who will be working from home into phase 3 of the Hamilton Reopens plan, will the city be able to help staff with getting proper furniture and chairs for their home offices?
Thanks, Jasmine. So yes, there's going to be, we'll be launching an online tool that is going to help employees set themselves up for a home office. It'll require some pre-approvals in terms of purchasing office equipment and office furniture. But we will be providing the supports to employees so that they are set up properly. If they're not able to properly set up, then we'll have a more virtual support available to them. Any purchases of course of office furniture or equipment is going to require a supervisory approval. So employees are encouraged to dialogue with their direct supervisor or manager to make sure that whatever purchases they make are approved, and that the supports are available to them. Working at home, the telecommuting policy, for example, has been expanded as a result of COVID. So while we're obviously encouraging more individuals or employees working from home, we're trying to expand the flexibility so individuals can continue to work at home, particularly as we're moving through the phases. We need folks to be working from home increasingly so, even if when we're in a situation where we're staggering the workforce back into the workplace. I think one of the examples we talked about earlier, perhaps 2 days 1 week and three days the next. So working from home is going to be our reality as we move forward, and probably on a more permanent basis. We've seen that the technology that's in place has made it very easy to work from home. So those of us that have struggled in the past, working from home is more of a reality, and we're more convinced that it's certainly suitable for us to do our work effectively and properly. So part of that is going to be the ergonomics of our workstations, and we need to turn our minds to it. But individuals should contact or consult with their supervisors, and as well our health and safety folks in HR. They can help with ergonomics of your workstation once that the equipment and furniture have been put in place.
Great, thanks, Laura. Next question will go back to Paul. The question is, I need to go into my office for some files. Do I need any kind of permission, or can I just go in at any time?
No, do not go in at any time. The bottom line is the facilities that are closed, if people go in, we really should be then looking at a cleaning regime, recognizing you may say, hey, I'm not sick, but we haven't had the active screening done. We don't know, what have you touched? Where have you gone? So it would be best to have that conversation first. We recognize that at times people will need to go into the office and retrieve some stuff. The other thing that can happen is if, a few people need to go in and do it, it would be better to organize, not that they all arrive at the same time, but maybe go all at the same day. The reality is, if we don't have to clean some areas because nobody's there, it would be better that we don't waste the money and spend the time doing that. But if people are going into the offices, we really should be cleaning as they go, so that if somebody else was to come shortly after, we have an understanding that we've done the proper cleaning, or else it starts to fall apart. Our charge to you and our hope for you is that there really isn't a need to go in if you haven't needed to before. But in those cases where it's like, yeah, I've got to get a few things, talk to your next level of supervision. And if you need some guidance or advice, obviously through the departments, we can help make that happen and ensure that we don't want to block people from it. But I don't want to send the message at all that you can just kind of come and go from the offices even though there's closed because you have the proximity card or you have the access on a regular basis. Recognize that when you go in, we need to make sure that we've done the proper cleaning when you leave, and that we want to know that you're there. So it's a whole bunch of reasons from a security perspective and a cleaning perspective. So please do not just decide to get up on a Tuesday morning and head into the office to gather a few things. You need to have that conversation in advance.
Thanks, Paul. Laura, we're going to come back to you. We got a lot of questions about vacation, so we just chose one. So the question is, I have vacation to use this year, but my vacation plans have been canceled because of the closures. Can I cancel my booked vacation or carry these days over until next year?
Thanks, Jasmine. So we had initially said that any vacation that had been pre-booked or pre-approved prior to May 25th was to be canceled. After May 25th, SLT made the decision that any, again, pre-booked, pre-approved vacation needed to be taken. So a couple of things there. Recognizing that perhaps your vacation plans have been canceled, or there's, obviously not as much opportunities to enjoy vacations, either going abroad or going on some sort of vacation. It's still important that employees take time off of work. They need to decompress. They need to make sure that they're getting that time away from work and dealing with all the stresses and anxieties, because we've been going full force for such an extended period of time. So though that any vacation beyond May 25th needs to be taken subject to operational requirements. And having said that, we're also encouraging employees to take their vacation. So start scheduling your vacation. Make time. I mean, some services are open now. Parks are open. Some of the trails are open, though. So there are other opportunities for you to enjoy your vacation outside the home. Spend more, quality time with your family when you're not worried about work so much. And we're also running out of the year. So here we are, almost in June. We've got 6 or 7 months left, and most of us have almost all of our 2020 vacation entitlement remaining. So we do need to schedule it. We need to put that time in our calendars. And in terms of carryover, SLT made the decision that we can carry over up to a maximum of 10 days into 2021. With the requirement that those 10 days are taken prior to June 30th of 2021. And all of the 2021 vacation is taken by the end of that year. But the carryover is, again, subject to the GM's approval and discretion. Right now, we continue to recommend and advise employees to take their vacation, take some time off of work, recharge the batteries, and make sure they get some much needed rest away from the workplace.
Great, thanks, Laura. So we just have a few minutes left. I think we'll do just one more question before we wrap up. This will be for Dan. Dan, can you speak about how the pandemic has potentially affected plans for hundreds of staff who are moving to 100 King or into the Lister Annex? Will there be any design changes, and is there a new timeline for the move?
Thanks, Jazz. We don't have a firm timeline for the move yet. One of the fundamental questions we had to answer was this, the point that I alluded to earlier about the workstations and the corporate standard, and whether or not it was appropriate to change that at this point. So I guess the short answer is don't have a firm date for when we're going to do the move. Hopefully it won't be delayed too long. The second part is there will be some kinds of implications as a result of the COVID experience. Don't completely know the answers to all of that right now because of the specific details in the different floors. But the other thing that I would say is that this idea that we're going to try to work remotely as long as possible, that's the other thing that's going to weigh in here. So notwithstanding, we're going to get the floors ready, but the way that we come back to work, the number of people that we bring back to work, that's still a question mark. I think corporately we want to let some time elapse between making some of those decisions, because we know that the way we do work has changed probably forever in some ways and in some areas. So still a lot of unanswered questions, but we're going to continue to forge ahead with making the changes there, because we know at some point, to some degree, we are going to return there. It's just a matter of when and how many.
Great, thanks, Dan. So thanks to everybody who submitted questions for the town hall. For the questions that we didn't get to, we will do our very best to address them over the coming days on ENET, on Howie, and on our website. Before we wrap up, I'd like to once again thank Jeanette, Paul, Elizabeth, Jason, Dan, Mike, Laura, and John for participating today. As well, thank you to the communications team and to Cable 14 for leading the production of this town hall event. Please remember to keep up to date and informed on the city's continued response to COVID-19 and our progress as we begin to slowly reopen municipal facilities and restart the city services and programs that were modified or canceled due to the pandemic. Keep up to date by visiting hamilton.ca/reopens or find more information on ENET or Howie. As well, as we've mentioned, your senior leadership team and your own directors and managers will continue to keep you updated as we move toward our new reality. Thank you for joining us, and stay healthy.